Philip Lumb, Professor and Chairman of the Department of Anesthesiology at the University of Southern California Keck School of Medicine in Los Angeles. Became fascinated when I was doing surgical house jobs in Great Britain with postoperative nutritional support and the postoperative recovery of patients. So I became interested in critical care medicine and anesthesiology for those reasons. Elsevier is significantly engaged in a number of products out there in terms of information searching and acquisition. E-books themselves are great, except when they tell you that you need to turn them off when they're shutting the door of the plane. But I do know that our residents find it much easier to use the products, and with the ever-expanding flurry and barrage of information that's coming out, quite frankly, the searching capabilities of the electronic media is far better than anything else I've ever seen. So it really will take over, and equally they will probably be far easier to update, so they won't be as much time limited as waiting for the next edition of a standard textbook. Well, this is the first edition of the book, and it's on critical care ultrasound. And the first person I need to mention is Dr. Karakitsas, who's the co-editor and indeed one of the driving spirits behind the book. He, based in Greece, is a phenomenal individual, has been involved with critical care ultrasound for a long period of time. We met one another actually through the Journal of Critical Care. That's a journal that I edit, and it is the official journal of the World Federations of Societies of Intensive and Critical Care Medicine, as well as the Society for Complexity and Acute Illness. And Demetrios became interested in writing a couple of articles or submitting a couple of manuscripts on ultrasound, then wanted to know whether or not we could create a section on clinical ultrasound within the journal. And finally, we felt it was time, and he came up with the idea. He has extensive contacts in the critical care world, most specifically in Europe, but also in the United States. And we created an author list, and I think have designed a comprehensive textbook in critical care ultrasound. It is incorporating and will include most of the advances, including optic nerve imaging for intracranial pressure rise, and a complete section on lung imaging, which is often slightly underutilized. So I think overall it will be timely and right on target. We're just better. No, I think that it's targeted to critical care physicians. It is written by critical care physicians who have a wide-ranging scope of expertise, and it's a new field, so I think it will be one of just a few textbooks out there, and I think it comes from the right perspective, written by clinicians. Well, my relationship with Elsevier is now quite a long one through my editorial responsibilities on the journal side. This is a new venture for me. I find that Elsevier, to this point, the electronic submission system is very, very similar to the journal's electronic system. So access has not been hard. Downloading is relatively easy, and the editorial process is now essentially paper-free. And if I can find enough time to do the editing, it should also be relatively rapid.